Hi guys, I wanted to talk to you about a devastating type of dementia that is not Alzheimer's. It is called Lewy-Body Dementia. It is actually not uncommon. Many patients suffer from Lewy-Body Dementia, and it's a very challenging disease. One, because it can go undiagnosed for several years, as it does not present similar to other types of dementia, namely Alzheimer's. It has some very clear features of Parkinson's, so it's often mixed up with Parkinson's. It is not until the patients reach some moderate to advanced stages when they experience some abnormal behaviors. The diagnostic criteria often involves what's called REM behavior disorder. You may have heard of REM behavior disorder. This is a very peculiar condition during which patients act out their dreams. They feel like they're actually in real world when they're dreaming, and their brainstem nuclei and circuits is not able to paralyze their muscles as would normally occur in the dream state. So patients are often found punching their partner in bed because they're having a horrible nightmare, maybe finding some sort of a demon in their dream. And it's not unheard of for these patients to injure their partners or themselves because they literally catapult themselves out of bed and start fighting as if they're in that dream state. Patients who have REM behavior disorder, they often develop these symptoms later on in life, meaning they begin with REM behavior disorder and later in life they develop symptoms of Lewy body dementia. REM behavior sleep disorder, unusual Parkinsonian symptoms that are linked with behavioral disturbances and memory loss and other cognitive signs and decline can often suggest the likelihood of Lewy body dementia. And that's what often triggers the diagnosis. What's interesting, as many patients may know already, is that Parkinson's disease often also develops cognitive decline, but that is quite different than those who have Lewy body dementia. The only overlap between those two is that they have both Parkinsonian symptoms, i.e. some tremors, trouble with walking, a flexed posture, and other abnormalities that are usually labeled as Parkinson's. That initially involves often very non-specific and subtle signs of Parkinsonism, such as, for example, loss of facial expressions, reduced blink rate, and perhaps loss of sense of smell, and mild Parkinsonian features, such as the rigidity of the muscles. Later on, patients start to develop some very strange and peculiar findings, including having visual hallucinations of thinking that there are objects or people that ran just by their visual fields. They start to behave very oddly. They start to have odd behaviors involving impaired executive function, emotional dysregulation. They start to have unusual panic attacks, even mood disorders such as severe depression. They also develop hallucinations sometimes of people or things. And in addition to that, they may in fact develop psychosis, where people feel that everyone's trying to harm them in one way or another, similar to other psychotic disorders such as schizophrenia. The important part about Lewy body dementia is that you are seeing some red flags. It is definitely best to bring that patient to a neurologist and have a very good detailed examination and history. Unfortunately, there are no curative medications. There are no substantial improvements with the standard medications that are used. More often than not, patients are placed on antidepressants or the standard Alzheimer's treatments, such as, for example, donepezil or rivastigmine, with really mixed and lackluster results. We have seen some improvement, especially with respect to behavior, executive function, with brain modulation, with the use of brain stimulation and some new technologies. And this has actually brought a lot more hope to those patients suffering from Lewy body dementia. On the treatment side, again, brain modulation with transcranial magnetic stimulation is offering another layer of hope, another layer of treatment outside of the standard medications. And I encourage you to learn more about this condition because, in fact, it is not uncommon and can be very common. It's just sometimes misdiagnosed or underdiagnosed. Thank you for your attention.